Number 5, focused ultrasound for non-invasive brain surgery. Focused ultrasound is a non-invasive therapeutic technology using sound waves that has the potential to transform the way that surgeons treat many medical disorders, including brain cancer and Alzheimer's disease. By using ultrasonic energy, it is possible to precisely target tissue deep in the body without incisions or radiation. This bloodless procedure offers patients the potential of less pain, fewer risks, and quicker recovery from their procedures. When it comes to disease of the brain, currently available treatments are often ineffective or accompanied by significant side effects. The prognosis for many of these patients is grim. Typically, brain surgery entails removing parts of the skull, followed by a lengthy procedure involving appreciable risk and recovery time. Even the slightest surgical error could result in stroke, seizure, or a movement and/or memory disorder. Moreover, radiosurgery and radiotherapy are suitable only for limited indications and cannot be repeated. Focused ultrasound is now being tested in humans for use in brain surgery as a sort of ultrasonic scalpel, a novel therapy that ultimately has the potential to replace neurosurgery and radiosurgery. Surgeons now have the ability to deliver high frequencies of ultrasound precisely to diseased brain tissue, raising the temperature and destroying cancerous lesions. The therapy also allows for unlimited retreatment sessions, an option not possible in radiosurgery or radiation therapies. Research now suggests that focused ultrasound can also make the protective blood-brain barrier wall more porous. Overcoming this limitation could revolutionize neuropharmacology and could be a game changer for therapies for CNS disorders such as Alzheimer's and Parkinson's disease, as well as brain cancers. Being able to modify this barrier and allow drugs to reach the brain, and to do so only in the locations where the drugs are needed, will transform the development of drug therapies for the brain.
Dr. Alex Golby is a neurosurgeon who is advancing these sorts of techniques. And Alex, can you tell us how the prospect of bloodless surgery now can go from a niche application or experimental technique to potentially treating a wide range of ailments? And what sort of time scale or process do you see that taking?
So the initial application of focused ultrasound as bloodless surgery has been to thermally ablate areas of the brain, and in particular brain tumors. And that requires the delivery of a fairly high amount of energy through the skull, which complicates the delivery of the energy to the target. But as the researchers are developing new approaches with focused ultrasound, they're actually able to accomplish a therapeutic effect with far less energy requirements through the skull. So a combination of focused ultrasound plus microbubbles can be used to create cavitation in the area and greatly enhance by several orders of magnitude the energy that's delivered at the focal site. And then also, as was alluded to, the idea of using focused ultrasound to disrupt the blood-brain barrier also can be accomplished with several orders of magnitude less energy delivery. And so that means that the therapy could be accomplished more readily, more safely, and potentially could open the door towards repeat treatments. And in particular, the ability to focally and reversibly open the blood-brain barrier, when it's coupled with the innovations that you've heard about in localization through imaging or biomarkers, really has the potential of greatly opening our therapeutic alternatives for a number of diseases, as mentioned, for example, Alzheimer's disease, because the blood-brain barrier presently is such a great obstacle to delivering certain kinds of therapeutics.
Thanks. A name like microbubbles begs for an explanation. Can you just tell us briefly what microbubbles are and how they are used in this context?
So they're little tiny spheres which can contain an inert gas or can contain actually a payload. And when the sound waves hit the microbubbles, they can explode them, which can create either delivery of the payload or an enhanced effect